Hi, everyone, and welcome to today's webinar on tips for managing remote employees during these times. And we're saying that because while there are a lot of people who worked remotely before this, and there seems to be an illusion that remote working pre-COVID and remote working during COVID are the same animal, and they're not. So we'd like to go through some research that we have that shows why it's not, some tips that we have for how to manage people, some cohesive ideas to make sure you're thinking about as a leader, and kind of what this can all look like. I'm Dr. Kristen Donnelly, one of the good doctors of Abbey Research, and you'll be meeting Dr. Erin Hinson in a couple seconds. So let's get started. So first of all, we here at Abbey Research really love maps, guys. We just love them.
Big fans of maps.
Big fans of maps. And so this is today's. We're going to introduce ourselves just a little bit in case we've never met. Then we're going to dive directly into the research. Gallup has been busy little bees, making sure we have all of the data that we need to make really informed decisions. And between Gallup and some other sources and some research we've been doing on our own, we've got some evidence for you as to how we should be moving forward. We're going to talk about what managers should keep in mind when they're thinking about their individual staff, as well as a long-term strategy, as where a lot of us, especially in the Abbey Research part of the country, which is the Northeast, are kind of coming out of the fire hydrant level crisis that was going on for a little bit, where something was changing every 7 seconds. Now we're settled into this for a little bit, and so it's time to breathe and think about long-term strategy, and we're going to help with that. Some final tips, and then some ways that we can connect after today. So this is us. Hello!
Hello.
I am Dr. Kristen. I'm wearing the glasses.
And I'm Dr. Erin Hinson, and I have the curly hair.
And those two things are always true during COVID or not.
What our hairstyles look like during COVID, there's a reason you're not getting our videos.
Yeah, we really, really, really miss haircuts. So we are both doctors with social science degrees. We met a little under 10 years ago while we were living and working in Northern Ireland. We are both business partners and best friends. And we have a combined 30 years of research and business experience being taught how to analyze groups of people very quickly and how they interact as a culture in and of themselves and how they interact with their larger cultures as well. So we like to say we are saving the workplace one hard and healing conversation at a time, because we are not scared of the tough questions that come up when people work together. And today is a really good example of that. We understand how difficult evolving human situations are, and we are going to do our very, very best to give you some practical strategies for navigating new waters. Speaking of, this is kind of our approach. We do this with everything we do because we believe that this is the best way that people can learn and grasp, and we can leave you better off than we found you. So we start with generic key terms and topics, and then we get to specifics. You'll see that today as well. And then we end with action. We want to make sure that every time you end an interaction with us, you have clear and concrete things that you can put into place immediately to address whatever issue we were talking about together. And today's issue is remote working. So like I said at the very beginning, this is not a normal remote working situation. People who have been remote working for a long time, like Dr. Hinson has been, will tell you that it feels different too. Even if your whole life is set up to work remotely, this is still different. If your office has been set up to work, kind of partially work from home every once in a while, that's not what's happening now either. And if you're somebody who has had everybody in the office all the time, that's definitely not what's happening now. So literally everything is different because everybody is working under exceptional amounts of stress and ambiguity and disruptions to routine that no one really knows what to do with. There's times that I wish that the sticker that this person's feet on was at every establishment throughout the United States, because it would be helpful to remember how to kind of this new way. Every time somebody gives me a clear instruction these days, I'm pretty happy to follow it because I'm tired of thinking of all of the ambiguity out there. But speaking of, these are kind of the categories of the remote working we want to talk about.
Yeah, so when we sat down to build out this webinar and discuss what we wanted to talk about, like, it's really easy to talk about some of the short-term ways that we know you've been planning. And as Dr. Kristen alluded, right, that we've experienced a dramatic shift in the way we live and work in the last several weeks. And for a lot of us, it was drinking out of a fire hydrant every day. Things were changing every day. Rules were changing every day. And you had to probably, solve a lot of immediate problems, especially if you were transitioning from mostly an on-site workforce to a remote workforce. So we're going to talk a little bit about that, but we also wanted to take this opportunity to talk about some long-term strategy, because we are, in a weird way, settling in to this long-term isolation. And from any estimate we can find, we're going to be at this for a little while longer. So, what does your work environment and your work culture look like on the other side of this, whatever the other side of this is? And so we've got a couple tips at the end to help you start thinking about different areas you can start to long-term strategize. So what does the research say? As Dr. Kristen said, our friends at Gallup have been very enterprising in recognizing very early on that this is not normal remote working circumstances. And so they have asked a lot of questions of people and provided a lot of information on their website. So if you're looking for more data, they have tons of it. We're going to take some of their data today and ask some questions of it and analyze it a little bit deeper to provide you some more insights. So one of the most important ones, right, is that remote work has doubled in the last month. From March to April, we've gone from roughly 30% of Americans working full-time from home to 57%. 28% of us are experiencing some form of job loss or reduction, and those numbers will certainly go up the longer this crisis goes on. But another really key statistic here is that 81% of people expect COVID-19 to have a negative effect on their workplace, if it hasn't already. So especially for remote workers, I think, we can have different categories of this, like, a negative effect on your workplace could certainly be your workplace closed down because it was a service industry job that has been deemed non-essential. So that is a certain negative impact, but like, what are some of the more stickier ones for remote working? That's what we're going to be looking at specifically. And obviously the concerns of ongoing mental and physical health that come with prolonged isolation. So we've got a lot of information that we've been thinking about, a lot of anecdotal stories from our friends and colleagues who have been working remotely for the last couple of weeks to look at some of these mental and physical health concerns and how you can help support your employees during them. So what do managers need to know about their people? We've said this at the start, and we're going to keep saying it. This is not normal remote working circumstances, and this is not normal working circumstances. So a lot of things that you might not have needed to know about your employees to be a good manager or a leader in an on-site relationship, you might need to know things during a pandemic working remotely. And so we've devised these 6 questions as a way to help you start thinking about some important conversations we think you need to have with your employees.
The first one starts with the acknowledgement that the conditions that they're working under at home probably don't match the conditions they had in your office. Even though a lot of the cultural kind of jokes right now are about how great people's commutes are and how everyone's happy that they maybe don't have to wear pants to a Zoom meeting, the reality is that most of us, even people who worked from home on a semi-regular basis, have not set up our homes to be working environments. So the chair that you had at work that's ergonomically great for your back and hips is probably not great when you're sitting at the kitchen table, sharing the kitchen table with your spouse or partner or roommates or children who are all trying to do the same work at the same time. So a great question to ask your folks is, what are the work conditions that they need to perform their best? So does it really help them, for instance, to have set meeting times with you, so that because they're coordinating quite a lot of things in their house? Perhaps they've got, perhaps they have their own laptop, but they've got 2 roommates who don't. And so they're all sharing your employee's laptop to try to make things happen. acknowledging that and saying like, okay, then Mondays at 11 are when we're going to be Zooming. The rest of the time I can get you on the phone, you know, maybe would be helpful. Also think about some coping strategies about the changing in these conditions, helping them think through how to do, you know, how to contact different services or anything like that. And then also, you may be in a leadership environment in which you've been taught not to ask personal questions to your people. And that's been HR rule of thumb for a really long time. But like Dr. Hinson said, this isn't that kind of time. So it's really good to know how many kids they have at home and probably what grades they're in and maybe what their schools are expecting from them. It's probably a great idea to know if they're caring for a roommate or a relative or something that's happening. If they're also driving for Uber or DoorDash or Amazon, you know, that's a good idea to know, and just kind of have a no judgment policy of like, I'm not going to make any statements about your work life here. I just need to know what we're working with. Because we also need to deal away with the myth that this is going to be a time of high productivity. Like I said, we need to be realistic about what productivity means. At Abbey Research, we've been banging the drum for a while that a 40-hour work week is not 40 hours of productivity, and that we as a culture and as humans have got to think differently about what work-life schedules and productivity mean, and what a better time to do it than during a global pandemic. So it's a great opportunity to think about what actually needs to get done versus what, you know, can get done, what could get done quicker if you have focused 20 minutes, what's something that can be done over longer term, who is responsible for what on a team that can be juggled a little bit. Realize that even though work is, we promise for your employees, a priority, we don't know a lot of people. There's no evidence of data that shows that the preponderance of Americans are looking for a easy way out or a 4-month vacation in this. People are absolutely concerned about their paychecks for sure, but they are very concerned about their responsibilities. A lot of people do enjoy their job, even if they don't enjoy their workplace or vice versa. And there's a lot of angst and stuff that the data is throwing up that people just want to make sure that they're still doing a good job. And they don't know what that looks like right now. And so that, as leaders, it's our job to help people figure out what a good job looks like. As I alluded to before, home and office, we usually do differently. I know Dr. Aaron and I both know folks that have standing desks at their office and don't have them at home, and that's really different. I definitely, like, the chair situation has been very hard for my husband, I'll say, because he worked at home sometimes, but he's now in full-time remote work. And the chair that we bought for our office, our home office, that's like, you know, you sit in for an hour at a time, is not great for his back 8 hours a day, 5 days a week. So we're having to Google some yoga stretches that he's never tried to do and figure some things out. Also, if their home is too small to provide a separate working space, or the layout of their lives doesn't quite allow for that, what does that look like? It's good for you to understand that no, they're not going to have a space for a quiet phone call, most likely. And so how does that work, and what can you work with together? And then, are there tech tools or furniture adaptions that you can help provide or help them think through? For instance, I mean, like, everyone and their mother is on Zoom. Great. We've all caught the Zoom train. Do you know about things like Asana and Slack and group meetings and Microsoft Teams and other things that allow for better communication? Because we're also hearing from some of our colleagues that they are now spending every minute of every day on a Zoom call, when some things could go back to being emails or with a real proper organized thing like a Slack channel or a Trello board could still be communicated in written form and does not need to be a meeting. There's hybrids of meetings and emails, and we need to be exploring those more thoroughly.
So after all of those kind of work considerations, the last 3 questions we have are more of those definitely more personal questions that might have been taboo 6 months ago, but that we would really encourage you as respectfully as possible to find out this information about your employees. So what are their caring responsibilities? How have they changed? And what support do they have? So are they caring for elderly relatives or neighbors? A lot of people are doing extra shopping, doing extra healthcare support for vulnerable populations who shouldn't be out and about during this pandemic. Maybe their mother provides a lot of their childcare for their kids, but they can't travel between those places, or they don't want to risk exposing their mother in those circumstances, and so they've lost their childcare support. Do they have kids? Are they homeschooling? Do their kids have special needs? It can be really different depending on the schools. I know I was speaking to somebody who has 3 kids, and one of their kids is in private school, and so the private school has provided support and tech support, and they've gone Zoom meetings, and their son sits down at the dining room table in his uniform and is there from 8 to 3 every single day. But their other 2 children are in public school, and they haven't been receiving communication about, when the students are going back to school and what kind of support the parents need to do. So there's a lot of differences that can be happening within that, particularly if their kids have different learning abilities or different needs in a learning environment. That's really, really challenging for parents right now. And an extra emotional concern that they didn't have before this, even if they might have been working remotely, right, is worrying about the effect that this will have on their children and their children's education. Is a burden that myself, I don't have kids. That is not a concern that I have. I have a lot of other ones, but I am not having that emotional burden. So that's something very important to consider. Moving towards the mental and physical health issues, do they have pre-existing health conditions, and can they continue to receive treatment or treat those? Dr. Donnelly talks a lot about her chronic pain. In a lot of our work that we do at Abbey Research, she's having a difficult time managing that because she can't get to her normal treatment that she does. Do they have mobility issues that are impacted by this? And, how are they able to creatively manage their pain or not manage their pain or health issues, and how can you support them? It's really important to have that conversation because that's going to impact their ability to do their job. If they have migraines and the work situation isn't great for them, that's going to impact their ability to meet deadlines and manage their workflow. And finally, this one is really tricky, especially now, but do they have pre-existing mental health issues, and how are they treating for them? This is something you definitely might not know about your employees unless you're an HR manager who deals with health insurance claims. But are they in treatment for therapy? Are they able to do teletherapy? Are they getting the medications that they need, or the stress management treatment options? If those have been disrupted, how are they coping with that, and how can you help them cope with that? This would be a really great time for you to do some research and kind of take that burden off your employees. Investigate how the healthcare, if you offer healthcare for your employees, investigate how that's changed. I know I have a family member that's a therapist, and she said that a lot of insurance companies are paying the full fee so that her patients don't have to pay a copay. So if that's something that's happening, you could let people know, because if a copay is something that is prohibiting them from accessing those services, you can help alleviate some of that burden by even just doing the research and finding out what's available, what's covered under your plan, and how they can access it. So looking at a long-term strategy, those are a lot of short-term questions and things we can kind of help navigate. But we wanted to start thinking a few months ahead of time, because you don't have enough stress in your life that we want you to actually start thinking about what a few months from now might look like. But it's certainly a concern for a lot of us. As you can see from our friends at Gallup, 63% of US workers expect these disruptions to last for a few more months. We're certainly planning through to possibly June, July, or August. And so you need to start thinking about the long-term cultural health of your organization, especially as we're a lot of remote working situations are sort of settling into some new patterns. And if it looks like we'll be in this situation for another couple of months, we have some questions for what you can do during this time and what you can do once you return to your on-site work environment.
Because the reality is you might not, when you do return to your on-site work environment, things are going to be different. People are going to know that that working remotely is possible on some level, and working from home is possible on some level for most of these jobs. There's a lot of employees that have been saying things on social media about times that they've asked for accommodation from their employers and have not received it, that now, well, we're all getting that accommodation. So some of those conversations are simply going to be different. But our guess is that if you're here and you're spending time with us, that you want to make accommodations and you want to keep your culture going and you want to do all those things. So a great mental exercise is what kind of actions can you do now and later to continue the work culture. There are some workplaces, like my husband's job, he's in IT, and they're having weekly Zoom happy hours on Fridays because they used to kind of do happy hours together in person in the office on Fridays. And so they're doing it, and it's become a highlight of his week, to be honest, and a really important time. They played Pictionary. A couple weeks ago, they played Cards Against Humanity, and I could hear him laughing so hard through 3 closed doors. I think it was the best time he had had in weeks. So that was really helpful. I know some other places that are organizing like online pub quizzes. We here for a couple of our remote workers, we've been trying to do lunch for people. So you just gotta like create new, but it's a good thing to think intentionally about. Have you heard any other things, Dr. Aaron?
I've heard a lot of people doing happy hours or, kind of lunches for the team where, you can order from Chipotle, send everybody Chipotle to their house. And then once everybody gets their order, you guys can hop on and just have lunch together. Because I think there are so many everyday interactions that we have that seem really small with our colleagues that aren't on the basis of deadlines or meetings, the times you all go into the lunchroom at the same time to make a cup of coffee, or you go for a walk after lunch with one person. All of those things are gone right now. And those are the small things that we might not be able to pinpoint build the culture in our organizations, but they're essential and they're a huge part of it. And if they've all been removed, you have a void that you need to try and fill as best you can. So we encourage you to be creative about that. But we also want you to start thinking about if and when you return to the office, what that looks like, which is a real big, scary topic, especially because there's very little we can concretely say we know about the health of our organization, the health of our economy, the physical health of our employees. But as we settle a little bit into an isolating routine here, we want you to encourage you to think about what you might be able to plan for the readjustment period, how you will deal with people's long-term physical and mental health issues, trauma-related issues. We would certainly encourage you to start looking at trauma-informed care and resources, and we're putting together a resource list for that that we'll make available as well. How will you help grieving employees? How will you continue to provide support for your employees once we all come back to the on-site office? Because there is no going back to normal. I think at this stage we can all recognize that our city and our state and our organization and our country and our globe is going to be forever altered when we come out the other side of this pandemic. And we don't know what that looks like, but there are some things we know we can plan for, and it wouldn't hurt to start thinking about how you would provide support during that time.
So quick tips that are easy to say and very difficult to implement. You're welcome.
You're welcome. We're here to help.
We're here to help. These are the things, honestly, these kind of 3 categories are some of the stuff that we talk about with people day in and day out, because they are nuanced for every experience, opportunity, and culture. So the first thing to remember, and this is one of our company mottos, is that different people are different. When you read management books from the 70s, 80s, 90s, and even early aughts, you find a lot of language about managing teams as though they are monoliths. And I think in the last 10 years, we've begun to understand that that's not how humans work. So managing was always difficult. It's become even more now, for sure, because we're becoming more comfortable with understanding that individuals need individualized approaches. And that makes teams stronger, and it makes things work better, and it makes people healthier. But in times like this, where everyone's on a different level of crisis, it absolutely makes things more difficult for managers. And we do not want to beat around the bush or sugarcoat anything. It's hard. Your job is very hard all the time, but right now it's real hard. So the best that you can, we would encourage you to have conversations like we've been saying, asking what you're comfortable with, what you think your employees are comfortable with, and remembering that what works for one folk is not going to work for another, and giving yourself and each other grace as you kind of work through that. It's also very difficult right now because everything I just said is evolving. I know there are days where I feel like I have everything under control and I don't need a lot of help from the rest of my team and I'm doing okay. And there are other days where I'm like in the fetal position in the corner of my brother's office and I'm like, I don't know anything. And most people aren't as extreme as me, but everyone is kind of doing the best they can right now. And so different people doing the best they can looks different every day. So that's just the way it is. And that might not sound like a tip, but we've discovered in working with people that if you arrange your brain to see things that way, it really does make conversations and other things easier, because instead of getting frustrated that so-and-so isn't working the way that you want them to work or isn't seeing things the way that you want them to see them, you can just go, different people are different. How does this person see them? And it's almost like a mental reset.
Yeah. And along that line as well, in terms of managing different humans at this time, it's really, really important to manage as best you can their expectations, but also your expectations. And as particularly if you're at the top of a management ladder and you have different levels of managers under you who are then managing teams as kind of the branching out of your organization goes, make sure that all your managers are on the same page in terms of how they are managing the expectations for what the workers are producing. We've heard a couple of horror stories from our friends and colleagues of different management approaches. And some people are being, unempathetic taskmasters, and some people are being really flexible and moving things around and making sure that everybody has what they need, both emotionally and work related. So, we really want to encourage you to err towards the empathetic side of things. Understand that you're going to need to be flexible with work arrangements and deadlines. Things are going to come up that your employees cannot control at home in a way that they can control things in the work environment. And that's really, really key to remember. And set expectations early and clearly as much as you can, so that your employees know what to expect, what you expect from them, and what they can expect from you.
And how do people know what they can expect? We communicate. So this is one of those things, we mentioned it a little bit earlier. We think a lot of people are doing a lot of communication, but we don't know if they're doing effective communication. Mm. So people are spending a lot of time on Zoom, but we're not hearing that necessarily things are getting done in a productive way. And we've talked a lot about the stuff with productive. There's a lot of noise in our lives right now. And there are people for whom a really quick text message is a lot more effective than a 30-minute Zoom call. For instance, I'll just be very vulnerable right now. I am not frequently in the mood or have the spoons, whatever kind of phraseology you want to use, to have long conversations on the phone right now or over Zoom. I limit that time very, very fiercely. And almost all of my communication right now is text-based because of the sheer amount of information I'm having to juggle as part of my life. There are other people that need face-to-face conversations. But no matter what, everyone needs to know what's going on. If people were not mind readers before COVID, they are not mind readers now. And you need to communicate with your staff. And on another level, encourage an environment in which your staff communicates with you. The people that Dr. Aaron mentioned a couple seconds ago, where their bosses are being taskmasters right now, that's not an inviting environment to admit when that you're struggling with something. So a side benefit to being a lot more flexible and a lot more communicative is that you'll actually know what's happening instead of just getting maybe some bullshitted report emails because they just want to get you off their back. So as you communicate as frequently as it is needed and it is advisable, this kind of all three of these kind of flow together.
And finally, I really liked some of the work that our friends at Gallup did. And one of the polls that they asked was, what do employees need from their managers, from their leaders during this time? And these were the 4 most identified things, emotions, needs that were identified in the poll. And so we're going to take each one and then expand on it a little bit more to help you understand what that might look like in this particular time. So the first one, not surprisingly, is trust. They need to understand that you and trust that you will support them as best as you can and that you will be as transparent as possible throughout this crisis. And we haven't really talked a lot about vulnerability in this webinar, but we talk a lot about it at Abbey Research, and authenticity. And what that looks like during this time might be admitting when you're exhausted, admitting when you are in the fetal position of your home office, or you can't fathom getting out of bed. That might not be appropriate for your circumstance, and you can decide what level of authenticity is. But that will build trust as well. Building this culture remotely, your employees will need to understand what you're going through in a way that they might not normally in an on-site office capacity. And so finding ways to be transparent when you can and to build trust when you can is really, really important.
And all of that matches with their next point, which is compassion. So it sounds kind of trite, I think, a little bit, but it's not. It only sounds trite because it's one of the values that our culture likes to make fun of in some ways. But if you can communicate right now that the profit margin of your organization is not the only important factor in your day-to-day decisions, it'll go a long way. Realistically, I know that there are businesses who have already closed for financial, even before they were told they had to. They knew that they couldn't make payroll and they laid everybody off instead of just furloughing them. They said flat out, this is happening. I know some people that they'll be okay if they can open non-essential businesses before August, but once we hit August, there's absolutely no way to make payroll anymore. Keeping the lights on is an important part of business. Absolutely. And it's a part of business right now that a lot of people who aren't used to making those decisions are being kind of publicly negative about. And so being a business owner sometimes, right, especially right now, can feel very isolating in some ways. But the thing that everyone is crying out for and logic demands that we do is to remind all of our staff all the time that their health and safety, both physical and emotional, is a priority. That if you don't hold the profit margin and the people in tension all the time, I don't quite know how you do business. That's just personal. But that if you're holding them in tension, your people should know that. And they should understand that their health is also what's keeping you up at night as much as being able to pay them.
And along those lines, this third one is another one that's kind of difficult to imagine in these circumstances, and where everything seems so uncertain and everything feels so unstable. But stability is key. And you can build stability within your organization and within your culture in really small ways. It might be establishing a new routine for the people on your team. So maybe you run an office of 10 people, and every Tuesday morning you order them Starbucks coffee and muffins. And you guys sit around the coffee, the conference table, and you talk about whatever TV show you're binging or whatever. Create that. That brings a sense of stability. Order your folks some coffee or muffins, and encourage them to have conversations that aren't always work related on these Zoom calls as well. And provide as much stability as possible for them, as you can communicate what you can communicate and what you're able to tell them. Anytime you know something, tell them, and provide that stability, because even a small sense of stability is going to help your people function. It's going to help them meet the deadlines that they need to meet to keep your business running.
Yeah. When we first started this back in the year of our Lord, March, my father, who's been through a lot of kind of work drama, obviously nothing like this because no one has, but he's owned a company through a couple wars and 9/11 and some other things. The thing that he told my brother and I was absolutely over communicate, because one of the things it can do is not only provide stability, communicate compassion, and build trust, but it can empower hope. When folks can see that someone else knows what's going on, when people feel the previous three things we talked about, it's a lot easier to believe that we will all get through this together. We're not all blindly stumbling around with absolutely no direction. Some of us do know what we're doing, and we're going to do our best. And as long as this is working, we're going to keep doing it. And you just keep doing what I tell you to do, and I promise we're going to get through this. And that creates a real environment of hope. And at Abbey Research, we believe that hope is one of the engines of humanity. It's one of the reasons that we are who we are and how we work and how we function. And so the more you're able to create those three things, the more you'll imbue everybody with hope. And that's just going to end up, honestly, stronger for everybody in the long run.
So how can we help during these auspicious times? One of the ways that we can help, we've done a lot of research and a lot of writing over the last couple of weeks, as we have been forced to work apart from each other, and produced a lot of white papers on some key issues from this pandemic, including social changes and business changes and emotional health, but a lot of other issues that impact any workforce wherever you are. We've got a great white paper on remote working tech tools if you're trying to find ways to support your employees or ways that they might be able to support each other. So those are all free and available on our website.
Also, we've been doing in-person trainings and courses and workshops for a while now, and obviously that's not happening. And we are people who are going to be super fierce about following all CDC guidelines about gatherings of people. So we jumped into gear and started shifting some of our stuff into online courses. So the biggest questions that we talk about, for anyone who's never met us before, are issues around gender equity, diversity and inclusion in general. Conflict management is a big one for us. We talk a lot about multi-generational works spaces, which every single one is, by the way, and also emotional intelligence. So we're getting those together and making some adaptations in the acknowledgement that a lot of us are working in different circumstances, and keep an eye out for those in the coming weeks and months.
It is still possible to bring the good doctors into your environment virtually. We are more than happy and able to do remote lunch and learns, webinars, workshops, and trainings as a great way to bring something new and engaging into your office to keep your people educated and critically thinking while working from home. So if that sounds interesting to you, you can find out how to communicate us on any of the forms on this last slide.
Guys, we're everywhere. And the longer Dr. Erin's stuck at home, the closer we are getting to literally being on everywhere, including TikTok. So
I did say earlier today, if this goes through August, I'll be on TikTok. As of yet, no TikTok, but all these other social media platforms.
And we love to interact with you on all of them. So if you're watching this on YouTube, then any comment below to get in touch with us. If you're on our website, there's lots of ways all around you to make that happen. I used to say, please never call that number because I'm never at my desk. Guys, I'm at my desk every day now. So please feel free to give that number a call, and we'll be happy to have a conversation about how
we have an old-fashioned phone conversation.
If you would like to speak to a human, not on a video chat with your 19 pets behind you, I'd love to talk to you on the phone. And please go ahead and give that a ring. In the meantime, our deep hope for you is that you and everyone you love are healthy and safe. And we wish that for you for always.
Be safe and be well, everybody. Thanks for joining us, and we'll see you next time.